I'm joined today by Tolullah Oni, who is a public health physician and urban epidemiologist at University of Cambridge and founder of Urban Better, to talk about one of the biggest challenges facing humanity, and in some ways, it's entirely self-created. Basically, we have, was it 5 years ago, crossed the threshold of being a primarily rural species of humans to being a primarily urban species. And in that process, we've lost touch with the land, we've lost touch with nature, we've done a lot of damage to nature. But now this urbanization in and of itself is creating a lot of human challenges and human health challenges, which is what you spend your day job doing. Is that correct?
That is spot on. I should get you to introduce me everywhere I go.
So what is the biggest challenge of everybody moving to cities? It seems great on many levels. We're all able to live closer together now. I guess there's a challenge there on the COVID front and the primary epidemiology. If you're in the center of somewhere, I used to live in Hong Kong, where you're very closely packed. Is this contagious disease the big issue in cities?
Well, if we think about why people move to cities, it makes sense and is intuitive, right? You move for proximity to services, access to opportunities, connection with others, education, employment, the rest of that. But what people get in reality is quite another story. So when you think about cities, you think about buildings and you think about that kind of classic image of cities. When I think about cities, my epidemiology brain thinks about exposures. So I think about the house as an exposure. So what is the air doing inside the house? I think about the food around people. I think about the air that people breathe outside of a house. And so in reality, the challenge for health is not cities or urbanization, but the type and the nature of urbanization that we are embracing. And one of the things that has become really clear through this pandemic is that it turns out that when you urbanize by disrupting ecology, when you urbanize by having people in overcrowded spaces that enable more transmission between people, when you urbanize by limiting access to public and open space, when you urbanize by actually making care and services more distant, it turns out that's not good for health. Who knew?
In this urbanization process, I mean, there is the epidemiological element of that, which is you're closer together. It's more likely to transmit diseases. My sneeze can reach more people. That's kind of a yucky thought, but anyways, it can reach more people in a city than it can in a rural setting. But at the same time, cities bring adaptation, don't they? Can't we figure our way forward?
You're absolutely spot on, because nothing about what I said is inevitable, right? So there are choices to be made, and I think that's one of the critical things that we haven't quite internalized. So we react well, hopefully in the best case scenarios, we react well to shocks, but we don't internalize the fact that we have these intentional choices and decisions made today that increase the risk of shocks and stressors down the line. And that is this dissonance in time and space that is often that's difficult to grapple with. So if I actually use the example of COVID, just to drive the point home, because we're in this at the moment. Obviously, we know COVID comes from SARS-CoV-2 virus. We know it's largely airborne through aerosol transmission. And we know that, after you're exposed, if you're infected, incubation period is about 5 to 7 days on average. And you'll be infected from somebody who has been in that same space as you, largely through aerosol transmission. But now, can you imagine if exposure to the SARS-CoV-2 virus in London today resulted in COVID illness in Hong Kong in 2 years. At the same level of mortality, the same level of carnage, would we react as fervently as we have done? And shouldn't we? So that is the perpetual challenge of urban health, because a lot of if you look at air pollution, which is, you think the air we breathe is a shared space. You don't have rich people going around in bubbles, so you think that'd be the most equal thing. But actually, we've set up cities in ways that where you actually still have unequal access to clean air, but we're not. We don't see this as urgent as something to address, because you don't see people falling ill and dying within 5 to 7 days. And it's not necessarily happening in the same neighborhood as you. So the air pollution that's generated in next door to you is not just affecting the people next door. So that is something that we need to grapple with if we want to prevent and maintain population health in the long term.
Okay, so it's very interesting what you're saying. I mean, you're highlighting something that I think holds true, not just for urban settings, but the most fundamental challenge we are all facing as a species right now, climate change. If we can't get ourselves together with the clear and present danger of COVID, which the world has, some elements of it have done very well. Wow, incredible development of these vaccines by the scientists doing that. Hats off to them. But in terms of getting policies together to prevent COVID and making sure that there is equitable distribution of the vaccines, we're way behind. But on climate change, if we can't get together on that, how are we going to get together on climate change? And you're talking about something that's even closer than climate change. And how are we going to pull that forward? What are the levers that we can pull? What are the potential ways that we can bring that change?
One of the things that's really interesting that I've had on this journey is realizing the importance of two things that I'm generally quite ill-equipped from my education, and I've had to learn very quickly. One is history, right? And the importance of knowing your history, both local history and global history. And then the second is philosophy. Understanding.
So a liberal arts education is important, you're saying?
It turns out, which is not, it didn't feature at all in my medical training whatsoever.
Okay, so why are liberal arts important?
Well, it's turned out to be an advert for social science and the humanities. It didn't turn out, it wasn't the intention, but it's absolutely true. The first, and I say history because when you trying to intervene in something as a motive as space and place, you have to understand how people connect to that space. Otherwise, and you can't really just say, oh, we did this in Amsterdam. Let's go off and try and do it. Let's do it in Bangkok because it worked really well. There's the history of how people connect to that space, and particularly the history of how people are excluded historically from that space, and what that means in today's terms is really important to understand. If I bring it closer to home, so I don't mean it just so there's a physical space, but also the social space of trust, right? So if you look at the context of the COVID vaccine and uptake today, understanding the history of how people relate and how people have been excluded and how people have been discriminated against, and understanding those injustices and understanding that those experiences are internalized and transmitted intergenerationally. So if you don't understand that history, you come in like a bull in a china shop and just, you think, hey, I'm doing good is better than nothing. It's like, actually, sometimes it's not better than nothing. Sometimes it's worse because the messenger matters, what you say matters. You have to show that sensitivity. So that's history. You can go into that. And in the context of cities across Africa, the history of how cities have been planned, and that colonial history of planning for cities to cater for the minority and not the majority, and now how that is playing out today is really important to understand. I'll tell you a story about Lagos as an indigenous city if I get a chance. And then the second is philosophy. And I say that because, as scientists, we often, we like to hide behind, science is just objective and science is just facts. It's like, we're all human beings, right? And we're driven, and there is an interpretive component, and there are drivers of what we want to achieve. And I've noticed in my work in different cities that some of the biggest barriers to actually changing anything is not understanding what the city is for. Like, what is the value system? What are we actually trying to achieve here? There's what we say we want to achieve, and there's what we're actually doing. And those are very different things. And if we can actually think about the purpose of the city, I think it's the people, stupid. The people are the economy. The people, we're the custodians of this planet, for better or for worse. It's the people, right? So if we're not centered around making people thrive and including people and ensuring that people are connected to their space in ways that then that address the very basic needs, so people can think long term to address kind of sustainability in the environment. If we're not doing that, everything else we're doing is just waiting for the next emergency, at best, and at worst creating the next emergency. So that's why I think liberal arts are important.
Fascinating. So in terms of looking at urban health, and you founder of Urban Better, and love to hear a little more about the work that you're doing with Urban Better. What are the biggest opportunities / challenges that we have as people move into cities and these cities grow? And I would like to hear about Lagos as an indigenous city as well. So a lot of three or four questions in one.
Yeah. So I'm Nigerian. Lots of things, but I'm Nigerian, and I've also lived for many years in South Africa. So I very much see myself as being African in that cheesy, if you like, sense of the word, in that kind of Pan-African sense of the word. And I am excited about the opportunity in that space for a couple of reasons. One, it's always a competition between Africa and Asia, but it's one of the most rapidly urbanizing regions of the world. So we see existing cities growing and new cities coming into being. And so the opportunity to do things differently is immense. To say, let's not just focus on, for a start, let's not build a city for 10,000 people when we know in 2 years' time it's going to be 100,000 and what that means. But secondly, we also know that cities are spaces of concentrated consumption and activity as well. So how do we grow in ways that are sustainable for the environment and for the planet that we need? How do we grow in ways that are inclusive and don't leave people behind? Because the rhetoric of or the thinking of let's just grow the economy, even if it's just a small number of people, and then everyone will thrive as a trickle down. We know that to not be the case. We know health doesn't trickle down from good intentions, is my favorite phrasing, because we all internalize health and well-being as to mean good, right? So even you talk about financial health means good finances, so health just means good. So if you're doing something good, you feel like, oh, and then I'll do this and people will get healthy. It's like, well, we know that's not the case, because if you don't actually think about it deliberately and think about, well, what are all the ways in which what I do here, thinking like an epidemiologist, how do those represent exposures in our natural environment? How do those represent air exposures, water exposures, building exposures, land exposures, food exposures? What are all the ways that I actually influence those spaces? And how can I not just not do harm? We have to be thinking beyond that. We have to be thinking, how can I actually improve the health of this population? That is the mindset we have to get to. So I'm a developer coming to a space. What is the health of this population, and how can I improve it?
So if epidemiologist was made an urban planner, what is your perfect city? I've now made you in charge. You're now in charge. What does it look like?
It looks like a city that has purpose, that is centered around health and climate as its central organizing principle as a start. To say everything we do in all aspects of the city have to actively demonstrate how they contribute to population health and climate resilience for everyone. That's a start. The second aspect, so that's in terms of the goal and the purpose of the city. The second aspect is that it would be youth privileged, because we often think about, we pat ourselves on the back when we have something and we're like, oh, let's get some young person in here to make us all feel good that we're including people. We're talking about things that are future focused. We have to center the youth perspective in it, not as an add-on extra. And I say, in the African context, it's not youth focus, actually. It's not youth privilege. It's just privileging the average person. The median age is 19 years. If you want to represent the average person, it has to be youth focused. So we have to change our mindset of thinking about that. Secondly, and thirdly, it would be, and related to the second around youth, it would be participatory. So it can't just be a top down, people coming in, this is how it is. And because the situation evolves, people evolve, the population evolves, the space evolves. And if you're just seeing democracy and participation as something that happens every 4 years, as opposed to something that is constantly engaging and including people and looking out for people that are particularly being excluded, I think we sometimes call them hard to reach, but it's more like not trying hard enough to reach, or at best, or actually actively excluding at worst.
So that's a great list. It's health and climate. It's participatory and youth. Are there any examples of this that you can point to?
So there are some examples of, say, integrating, rethinking the central organizing principles of government around health and sustainability. So there are examples from the Wellbeing Alliance, right, is a group of countries that are committing to center their budgeting on well-being. So you have New Zealand there, Scotland there, Wales there. Interestingly, Wales has I just want to get this right. I think it's called a Future Generations Act. And they have a Future Generations Commissioner, like countries have a Children's Commissioner. So somebody who is responsible for looking after the unborn, because nobody's representing them, right? So we're all taking based on our needs now, at huge detriment to the sustainability and the possibility of a future that makes people thrive. So those are some examples, and actually another example. This comes from a study that was done, not so much organizing principle, but demonstrates the power of integrating health into, say, urban planning. So there was a study in Wales that was spanned 10 years and looked at they were upgrading their social housing, right? And they looked at the impact of different aspects of social housing on over time on population health. And they found that there's details on the types of interventions that were done in the housing, around heating, around ventilation, around outdoor space. They found that putting in those interventions over a 10-year period reduced emergency admissions by 40%. Just let that sink in for a moment. GP visits significantly, reduced asthma, the dose of asthma medication that people were taking. So that was just a housing intervention. But it was a 10-year trajectory. So how are we thinking, it's the good bang for a buck is long range. But the problem is we're often very short term in our thinking.
Okay, so let's
find a way. That is very expensive.
So let's find ways that we can convert this short-term thinking into long-term thinking, both for urban and beyond. But starting at urban is where we've got half of humanity. It's young. They're going to adapt. The cities are changing, so we can adapt the cities and really move things forward in a tremendous way.
Absolutely critical, and that's why I put young people in there, because there is no you're not jaded by nothing can change. And I think this is one of the things that has come to light from this really tragic and event of the pandemic, right? Is the one thing that we've seen is that anything is possible and change can happen very quickly when we have the mindset and the willingness to do that, right? So if you look at the investments in health that we've been saying are absolutely needed, it's like, oh, there's no money. Oh, well, it turns out when we have a pandemic, right? It turns out the health and the economy, we don't say, oh no, we can't do what we need to for the pandemic because of the economy, and let's protect the economy. Well, that sounds stupid in the middle of a pandemic. It should sound stupid, period, at any time.
So let's not waste a good crisis.
Let's do our best. Let's do our best to avert the next crisis, right? And let's not be surprised when the next preventable crisis comes along, and how we recover from this now is laying the ground for the risk of the next epidemic, the next outbreak, the next pandemic.
Excellent. Thank you so much for your time.
Thank you.